Alzheimer's disease is a progressive brain disorder that slowly destroys memory and thinking skills. It affects millions of people worldwide, causing significant emotional and financial strain on families. As the disease advances, individuals lose the ability to carry out simple tasks, and their personality and behavior can change dramatically. This not only impacts the person with Alzheimer's, but also places a heavy burden on their loved ones who often become caregivers. Early detection of Alzheimer's is crucial. Identifying the disease in its early stages allows for better management and planning. It gives patients and families more time to make important decisions about care and treatment. Early diagnosis can also help slow the progression of the disease through medications and lifestyle changes. Additionally, it opens up opportunities for patients to participate in clinical trials, contributing to research that could lead to better treatments or even a cure in the future. Current diagnostic methods, traditional methods. To diagnose Alzheimer's disease, doctors currently use several methods. Cognitive screenings. These tests assess memory, problem-solving skills, and other cognitive abilities. They help identify signs of cognitive decline, but can be subjective and influenced by various factors like education and mood. 2. PET scans. Positron emission tomography (PET scans) can detect abnormal protein deposits in the brain, which are indicative of Alzheimer's. This method provides detailed images of brain activity but involves exposure to radioactive tracers. 3. Spinal taps, also known as lumbar punctures. This procedure involves extracting cerebrospinal fluid from the lower back to detect biomarkers associated with Alzheimer's. It is highly accurate but invasive and can be uncomfortable for patients. Limitations. Each of these methods has significant limitations. Invasiveness, this is it. Procedures like PET scans and spinal taps are invasive. PET scans require the injection of radioactive tracers, and spinal taps involve inserting a needle into the spinal canal, which can be painful and carry risks of complications. Cost. These diagnostic methods are expensive. PET scans and spinal taps can cost thousands of dollars, making them inaccessible for many people, especially in low-income regions. Accessibility. Not all healthcare facilities have the equipment or expertise to perform PET scans or spinal taps. This limits access to accurate diagnosis, particularly in rural or underdeveloped areas. The new blood test. Introduction to the blood test. A new blood test is showing promise as a simple and accurate way to detect Alzheimer's disease. This test focuses on identifying specific biomarkers in the blood that are linked to Alzheimer's, such as amyloid beta and tau proteins 1. How it works. The blood test works by measuring levels of these biomarkers. Amyloid beta and tau proteins are known to accumulate in the brains of people with Alzheimer's. By detecting these proteins in the blood, the test can indicate the presence of the disease. One of the key biomarkers is plasma phosphorylated tau 217, p-tau 217, which has been found to be highly indicative of Alzheimer's too. Research findings. Recent studies have shown that this blood test can be about 90% accurate in diagnosing Alzheimer's disease too. This is a significant improvement over traditional methods, which can be invasive and costly. The blood test is not only less invasive, but also more accessible, making it easier for people to get tested early. Comparison with traditional methods. Compared to cognitive screenings, PET scans, and spinal taps, the new blood test offers a less invasive and more affordable option. It can be done in a regular doctor's office without the need for specialized equipment or procedures. 3. This makes it a game changer in the early detection and management of Alzheimer's disease. Research finding. Study overview. Recent studies have shown promising results for the new blood test in detecting Alzheimer's disease. Researchers have found that the test can accurately identify Alzheimer's by measuring specific biomarkers in the blood. One of the key studies demonstrated that the blood test has an accuracy rate of around 90 to 91%. This high level of accuracy is comparable to more invasive methods like PET scans and spinal taps. Comparison with traditional methods. The new blood test stands out for its simplicity and accessibility. Unlike PET scans, which require expensive equipment and exposure to radioactive tracers, or spinal taps, which are invasive and uncomfortable, the blood test can be done with a simple blood draw. This makes it a much more patient-friendly option. Additionally, the blood test is significantly less expensive, making it more accessible to a broader population. Implications. The accuracy and ease of the blood test could revolutionize the way Alzheimer's is diagnosed. Early detection through this test can lead to timely interventions, better management of the disease, and improved quality of life for patients. It also opens up new opportunities for research and clinical trials, as more people can be accurately diagnosed at an earlier stage. Implications for patients and healthcare benefits for patients. The new blood test for Alzheimer's disease offers several significant benefits for patients. First and foremost, it is much less invasive than traditional methods like PET scans and spinal taps. A simple blood draw is all that is needed, making the process more comfortable and less stressful for patients. This ease of testing can encourage more people to get tested early, leading to earlier diagnosis and intervention. Early detection through this blood test allows patients to start treatment sooner, which can help slow the progression of the disease. It also gives patients and their families more time to plan for the future, make important decisions about care, and access support services. Additionally, early diagnosis can improve the quality of life by enabling patients to participate in clinical trials and benefit from the latest research and treatments. Impact on healthcare. For the healthcare system, the new blood test could be a game changer. It has the potential to streamline the diagnostic process, making it quicker and more efficient. This can reduce the burden on healthcare facilities and professionals, freeing up resources for other critical needs. The test is also more cost-effective than traditional methods, which can help reduce overall healthcare costs. Moreover, the accessibility of the blood test means that more people, including those in rural or underserved areas, can get tested. This can lead to earlier and more widespread detection of Alzheimer's, ultimately improving public health outcomes. The test's simplicity and affordability make it a valuable tool in the fight against Alzheimer's disease, offering hope for better management and treatment in the future. Future prospects, ongoing research. The development of the new blood test for Alzheimer's disease is just the beginning. Researchers are continuously working to improve the accuracy and reliability of this test. Ongoing studies aim to identify additional biomarkers that could further enhance the test's diagnostic capabilities. Scientists are also exploring ways to integrate this blood test with other diagnostic tools to create a comprehensive approach to Alzheimer's detection. Potential for widespread use. The simplicity and affordability of the blood test make it a strong candidate for widespread use. As more research validates its effectiveness, it could become a standard part of routine medical checkups, especially for older adults or those with a family history of Alzheimer's. This widespread adoption could lead to earlier detection on a large scale, significantly impacting public health. Future improvements. Future improvements in blood test technology could make the test even more accurate and easier to administer. Advances in biotechnology and data analysis may allow for the detection of Alzheimer's at even earlier stages, potentially before any symptoms appear. This could revolutionize the way we approach Alzheimer's prevention and treatment. Collaboration and innovation. Collaboration between researchers, healthcare providers, and technology companies will be crucial in bringing this test to the forefront of Alzheimer's diagnostics. Innovations in telemedicine and digital health could further enhance the accessibility and convenience of the blood test, making it available to people around the world. Final words. Alzheimer's disease affects millions, and early detection is crucial. Traditional methods are invasive and costly. The new blood test is less invasive, affordable, and highly accurate. Stay informed about Alzheimer's research. Discuss the new blood test with your healthcare provider if at risk. The new blood test is a significant advancement in Alzheimer's detection. Continued research will help make it widely available and improve lives.